Hi, everybody. Today focus is going to be on the integumentary system. So let's go ahead and get started. So integumentary system includes your skin, your hair, your nail, your oil gland, your sweat glands, and basically together they form your integumentary system. So what is the main functions of this system? So one of the main functions is to basically protect what lies underneath. So as we know, underneath your skin, you have your basically the other 10 systems, which includes your cardiovascular system, your skeletal system, muscular system, nervous system, etc. So all of these tissues are basically being protected from either physical trauma or anything that could possibly cause harm in your external environment by your skin. So again, when we're thinking about your skin, think about it as both a physical barrier for any type of trauma, that could be force, pressure, burns, etc. Or it could be anything that can basically cause infection in our body, which we refer to them as pathogens. So basically, if your skin is intact, you will not be able to get infections, at least through your skin, because it acts as a very strong barrier. However, if you do have a cut, basically that barrier is breached and you will become more susceptible to infections. Another role your integumentary system has with the help of your blood vessels and blood is to regulate your body temperature. So think about when you are basically hot compared to your typical environment, which is, let's say, it's about 74 degree centigrade. Let's say you're in a sunny day, 90 degree, 100 degrees. What you typically see happens is you feel kind of this heat radiating off of your skin, and if you look at your skin tone or your skin, you would actually see kind of a red glow on your skin. So basically what is happening in this case is that your body tries to get rid of that extra heat that is present, and it does that by dilating or opening up the blood vessels that are formed inside the skin, and allow that heat to be radiated away from your skin and therefore cooling you down. You also have your sweating capacity that also help you regulate your body temperature. In the other scenarios, if you are in a cold environment, in a freezing environment, one of the common way of identifying somebody is in a cold environment is that their skin look pale. So kind of reverse what I said about flushing. When you are in a cold environment, the blood vessels of the skin will contract and limit the supply of blood to the skin, and therefore prevent heat loss through the process of radiation. So that way, because there's not much blood coming to your skin will appear more pale, compared when there's a higher circulation of blood, that it looks red or flushed. Now, your skin also produces chemicals that includes your sweat and your oil glands, which are basically called sebaceous glands. As we go through this PowerPoint, you will notice that there are two types of sweat glands that we have in our body, and those are referred to as eccrine and apocrine. The other function that we have a lot of nerve endings that are located in our skin. These are referred to as tactile, and they're basically responsible for creating your sense of touch. For instance, being able to distinguish your surface is hot versus cold, vibration through your skin, putting pressure on your skin, feeling a surface being smooth versus rough. All of these are through the tactile receptors that are located within your dermis and give you the capacity to basically be aware of your surrounding or your external environment. Last function I'm going to talk about is the fact that your skin is waterproof. So basically, we will not lose water through your skin unless it's through sweat, but naturally occurring water loss through your skin does not take place. And the reason for that is that the top layer of your skin, which is referred to as epidermis, is packed with a specific protein called keratin. And the job of this protein is, again, to minimize the water loss through your skin. And we'll go into a little bit more detail as we go through the PowerPoint. Now, what are the layers of your skin? So your skin has two major layers, and these are epidermis. Epi means above, so epidermis means above the dermis. This is the most superficial layer of the skin you have, which is basically what you see in the picture right here. And the thicker layer that sits underneath that would be your dermis. Dermis is really fibrous. It's made up of a lot of connective tissue. It has a significant blood flow, so lots and lots of blood vessels. In comparison, your epidermis has no blood vessel, and you can kind of think about it this way. If you have a really superficial cut on your skin, you won't see any blood. And that basically means the cut was only at the epidermal layer because there is no vasculature, and then there wouldn't be any bleeding. However, if the cut is deeper than epidermis, which means it extends to the dermal layer, then any type of cut will see signs of bleeding because dermis is highly vascularized. Now, the last layer that we have listed here is hypodermis. And notice that it's listed as not part of your skin layers. So what hypodermis is basically fat tissue or adipose tissue. It has major function. It does help you create a kind of a layer between the tissue that lies underneath and acts as an kind of a shock absorber. It does actually insulate your body in terms of it limits heat loss, so it helps you keep your core temperature constant, but it technically is not part of your skin. When I talk about insulation, it's interesting to note that as a person ages, this hypodermis layer becomes thinner, which means that your body slowly loses the capacity to insulate or prevent heat loss. So if you see a lot of elderly, even on a relatively warm day, they would wear multiple layers of clothing. And the main reason, again, is because they lack that insulation, or their insulation is not as significant as you would see in younger individuals. So here's another picture kind of highlighting some of the essential structures we can find in your skin. Again, identifying the epidermis, that's the top layer right here. You have your dermis layer or your dermal layer, which is this basically very thick layer. You can see within this dermis, I have my hair or hair follicle. We have these structures that basically come into the hair follicle. These are your oil gland, also known as the sebaceous gland. We have your sweat glands right here. So in this picture, we only have one of the sweat glands, which is called the eccrine, but there are technically two types. Again, eccrine and apocrine are the two types. What else do you have? You have your tactile cells. These are basically nerve endings that help you, again, measure pressure, fluctuation in temperature, vibration, etc. You have your hypodermis, which is this adipose tissue on the bottom. And one of the things that I want to mention here, and that's the only place I'm going to mention it, is this tiny muscle you see right here. This muscle is connected to your hair roots. This is called the erector pili muscle. So if you ever, I'm sure all of us have experienced this, when you have kind of like a chill or you get excited, you know, your hair stands up, right? The reason your hair can stand straight is basically, or goosebumps, the typical word would be goosebumps, is because this muscle basically contracts and makes the hair stand up straight. So again, the name of that muscle is erector pili. I don't discuss it anywhere else in the PowerPoint, but I do like you guys to remember that. Last note when looking at this picture is a quick note in terms of your dermis. Dermis actually has 2 layers, and I provide a little bit more detail later on. The very thin layer, which is typically about 20% of the top portion of the dermis, called the papillary layer. And then the remainder, basically 80%, would be what we identify as the reticular layer. And which is most of the structures we identify, like your oil and sebaceous, oil or sebaceous gland, your sweat glands, and your hair follicles, blood vessels are mostly located within your reticular layer. Now, what type of cells can we find within our epidermis? So epidermis, again, reminder, it is the top layer of our skin. Now, if I ask you guys to identify it as a specific type of tissue, the answer would be keratinized, stratified, squamous epithelium. And hopefully all of you guys remember from your histology lectures, stratified implies multiple layers, squamous implies flattened cells, and epithelium is the main type of tissue we have. So basically, what I'm saying is that there are multiple layers of cells or flattened cells stacked on top of each other to form it. And again, remember when you hear the word keratinized, we're talking about the protein keratin, which is essential in terms of protection of your skin. So again, going back to the cells of the epidermis. Main type is keratinocytes. Keratinocytes produce the specific type of protein called keratin, and they are literally majority of what we identify as epidermis. We actually shed millions of these cells every day. So basically, these are dead keratinocytes that your body would remove as the new cells are produced on underneath your skin or underneath at the bottom of the epidermis. Now, melanocytes. Melanocytes is another type of cells you see. They are definitely not as frequent as you would see keratinocytes. Their main goal, as the name melanocyte implies, is production of the color pigment of your skin called melanin. Melanin is extremely important in terms of protecting your keratinocytes against UV damage. So we'll go into this detail a little bit more later on after we take a look at the epidermis layer in a few slides. And I also mentioned our tactile cells or cells called Merkel cells. These are cells responsible for creating your sense of touch, pressure, fluctuation in temperature, vibration, etc. So we have talked about epidermis, and just want to kind of quickly mention UV rays and its relationship to melanocytes and keratinocytes. So UV stands for ultraviolet. This can be the main reason of skin cancers, which we also take a look later on. It can also cause loosening of the skin, which relatively common as a person ages, but it could be more severe if you have been exposed to UV rays at a higher rate. There are 2 types of UVs, a UVA, which is considered, which is a short wave. Now, I'm not going to go into detail what are the difference of them, Um, I do want to make sure that you understand that some UV rays are essential and important for you. Why is that? We have cholesterol in our skin cells. And when when UV rays hit the cholesterol, there is an actual change, and cholesterol can get converted to vitamin D. Vitamin D is actually essential for our function. We don't go into detail what the job of vitamin D is in our body, but it is good for you guys to know that some UV rays in a day is essential for us. Believe it or not, there are quite a few people that are actually vitamin D deficient, because they put a lot of sunblock, or we avoid sun completely, and we have very limited vitamin D in our diet. So do keep in mind that even though UV rays might be damaging, a small amount of it might actually benefit you in terms of vitamin D production. Now, we all have used it. We all have known about sunblocks or sunscreens. We have read and looked at SPF factors all the time, but what those letters actually means and what those numbers actually mean. So SPF stands for sun protection factor. And what that number means, for instance, if you have SPF 15, which is typically would say this is one of the lowest SPFs that we have out there, it means that it provides 15 times longer protection, or 15 times longer for you to get a sunburn when you put that on. For instance, in average, if it takes you about 20 minutes to get a sunburn, and you put SPF 15 on your skin, it takes you about 5 hours of protection before you get burned. Now, do keep in mind that if you're putting sunblock and you're in an environment that causes you to sweat severely, if you are in water, you go to pool or beach, doesn't matter. Either case, the water will wash that SPF or sunblock away from your skin, so you do need to apply it more often. But generally, the higher the number is, the longer you get protection. I do want to add here that putting a lot of sunscreen, especially the ones that go into 40s and 50s range, can actually cause damage on a long run. It can cause a skin cancer. The main reason is that a lot of times when you use sunblocks, the factors or components in the sunblock are heavy metals that are basically protecting you against those UV rays. However, many of these heavy metals can be absorbed through your skin and get into your bloodstream and last up to weeks within your bloodstream. They also can be present in the breast milk. So if you are breastfeeding and your baby is not necessarily getting a sunscreen or sunblock on their skin, they may still get exposed to those heavy metals that can cause damage in terms of nervous system, etc. So when you are doing that, do your research on your sunblock. There are ones that have components in them that are 100% natural, and they are not heavy metals. They are not seep through your skin to get into your bloodstream. So again, do your research before choosing your sunscreen. So don't just randomly pick one with a high number and put that on your skin or your family's skin, because that can cause severe damage in a long run. Now, going back to this whole concept of melanin protecting your keratinocytes against UV rays. So if you think about this, and let me find my pen. So imagine you have a bunch of cells, and these are your melanin cells. And then you have a lot of cells, and sorry, this is the best drawing that I can do. So these are your keratinocytes and these are your melanocytes. So again, keratinocytes are going to be significantly more common. There are layers and layers of keratinocytes on top of each other. Now remember that every cell that you have will have a nucleus, and within that nucleus you will have DNA. Now understand that UV rays can damage the DNA inside your cells. That damage can cause what we identify as mutations, which can lead to skin cancer, okay? So keratinocytes exposure to UV rays can lead to mutation of the DNA within those cells, and that can lead to cancer, more specifically skin cancer. So what is the natural defense your body has to protect this? So if you imagine, and I'm just gonna do a quick color change. So think about these dots that I have being the nucleus of my keratinocytes. And these are the ones that basically can get damaged again with your UV rays. So what you have is melanin, or sorry, I should say melanocytes come in and produce what we identified as, sorry again, this is the best I can do, melanin, which is a protein. So think about these melanin as these little dots that are packed inside these packages or vesicles, okay? So melanin gets ingested or comes into your keratinocytes, okay? And when they get into the keratinocytes, they literally form an umbrella or protective layer over what? Over the nucleus of your keratinocytes. So you kind of produce this shading over your keratinocytes nucleus. What is the goal of that? Basically, that provides a protection against UV rays. Now, that being said, does that mean you shouldn't have SPF or sunblock or sunscreen on your skin? No, this is just a way for your body to defend itself when there is no other protection. So when you go and get a tan, basically, now being in a tanning booth or sitting in the sun in a beach, doesn't matter. In either case, what is happening is your body is telling you that you're putting your cells in danger. You're putting your keratinocyte in danger. And this is your way of your body saying, stop doing that. So when you get a tan, is your body producing a higher level of melanin, which is a normal protein that gives you a skin tone, and that is the way it's protecting you. So people who are more fair-skinned, they produce less melanin, which means they are more susceptible to sunburns or first-degree burns. People who have a darker skin tones, they are producing a significantly higher level of melanin, which means they cells are protected for a longer period of time and therefore less susceptible to burns and skin cancers. So let's move on and talk a little bit more about the epidermis. So we said that most of your epidermis are cells called keratinocytes, but these cells have formed typically 4 main layers, and in some thicker layers or thicker skins, we have up to 5 layers of epidermis. Now, starting from the base, at the bottom of the epidermis, where epidermis basically meets with the dermal layer, we have our first layer called a stratum basal. This is the location where you have the process of mitosis taking place. And hopefully everybody remember mitosis. That's basically where your cells are going to actively divide. And through these active divisions, create new skin cells. So your new skin cells basically form from the base. And as these new skin cells come up, right, the older cells basically get removed. So if I'm looking from the first layer, stratnum basal would be the newest of the cells, the baby cells, if you want to kind of simplify them. And a stratnum corneum, which is the top outermost layer, the layer that you're actually touching if you're touching your skin, that's a stratnum corneum, which is basically dead skin cells. So what happens between the first layer and fifth layer? So you have a layer called, right on top of the stratnum basal, called a stratnum spinosum. And these are cells where you actually start to form these network of protein connections from one cell to its neighboring cell. These protein connections are called desmosomes, and they are extremely important for your skin capacity to withstand tension and not fall apart. Right on top of the stratnum spinosum, we have our third layer called stratnum granulosum. This layer is where you actually start to see a significant accumulation of the keratin protein, which are basically essential for, again, protection as well as waterproofing your skin. Stratnum lucidum is the layer I was mentioning. This is the layer that is only present in the thick skin, which are basically the skin that are covering the areas that have the most contact and therefore the most tension or wearing. So stratnum lucidum can be found at the palm of your hands or the sole of your feet, and again, absent for most of your body parts. And then the topmost layer is where you have 20 to 30 layers of dead keratinocytes. The main job of these keratinocytes, these numerous layers of keratinocytes, is to act as a physical barrier between your outside environment and internal environment. It is essential in terms of preventing water loss, and also, again, protection against bacteria or harmful material getting into your body. So do remember these layers. Here is a depiction, both on an image as well as an actual skin. So you have your stratnum corneum, which is the top layer, about 20 to 30 layers of dead skin cell. You have a relatively small stratnum granulosum and a stratnum spinosum. And at the base where you have your dermis, basically closest to your dermis, you have your stratnum basal, where your actual active process of cell division takes place and allows your cell to undergo the process of mitosis for creating new skin cells. I also want to quickly point out these larger cells that you see kind of tucked in between your stratnum basal layer. And these are your melanocytes, which are producing, again, melanin for the purpose of protection of your keratinocytes. And then your tactile cells or Merkel cells, which are actually embedded inside your dermis with kind of a minor presentation on the basal layer. Please, guys, remember that when we're talking about epidermis, one of the main characteristics, other than what I've discussed so far, is the fact that there is no blood vessels in the epidermis. So if you're cutting basically up to this layer, so through all of these layers of the cell, you will not see any bleeding. As soon as you start to cut through the dermal layer, then you are going to start to see blood, as dermal layer is rich with blood vessels and vasculature. Now, let's take a look at your dermal layer. So dermal layer is mostly made up of connective tissue. It does contain nerve endings. It does contain significant amount of vasculature, as well as lymphatic vessels. Now, I haven't really discussed the lymphatic vessels with you, but I do want you guys to just note it here. That is involved in both collecting extra fluid as well as providing immunity. Now, when we're talking about dermis, as I mentioned earlier, within this layer, you're also going to see your hair follicle, basically where your hair is growing out. You're also going to see your oil gland, also known as sebaceous gland. You will see your two types of sweat glands. And on the, basically, we will go into more details about each of these later on. Now, another thing I have mentioned is that the papillary layer is, sorry, the dermal layer is made up of two layers. The top layer, which is basically next to your epidermis, that's a thin layer. It's about 20%, called the papillary layer, or sublayer if you want to call that. It is made up of areolar connective tissue. So hopefully you guys remember that from your histology. And it is also made up of collagen fiber for the purpose of strength. It is made up of elastic fibers that is going to give us a little bit of recoiling ability. So basically, anytime your skin gets pulled, it always wants to go back to that original shape. Please do note that the elastic fibers lose its elasticity or the recoiling ability as a person ages. Reticular layer, which is about 80% of your dermal layer, consists of dense connective tissue. It does contain still elastic fibers. It does have recoiling ability because of those elastic fibers. They have significantly high concentration of what we identify as collagen fibers, which are essential for providing strength to your skin. And this reticular layer also play a role in keeping your skin hydrated by binding to water. Here is a depiction of the three layers or two sublayers of the dermis and your epidermis. Here is your thick layer of epidermis, and down here you have your dermal layer. The top, right here, you can see the papillary kind of different in terms of kind of structure, right? And then down here where you have those kind of reddish streaks going through, that's your reticular layer. Quick note in terms of the kind of the clinical cases you may see on yourself or your patients. So if you've ever been pregnant, you typically probably have stretch marks on your abdomen region. This is basically where the skin is stretched, extremely stretched, over a short period of time. So basically the skin doesn't have the opportunity to grow with the force of stretching. That causes these kind of silvery or white scars on the skin, and these are called stretch marks. There are I guess solutions or treatments that can help lower the stretch marks when you are pregnant, or remove most of its visible marking by healing your dermal layer. The other scenario you can see is what we identify as blisters. Blisters is typically happen either as a result of some sort of trauma where your skin is being rubbed, like when you have some sort of basically shoes that kind of come up and rubs against the skin. That's a typical one. Or when you have some sort of burn. Again, either of those cases are identified quote unquote traumas, and that causes the separation of the epidermis from the dermal layer, and water will basically build up in that and causes that blister to form. Now, what we're gonna do here, we're gonna briefly take a look at some of the accessory organs of our dermal layer. As I mentioned earlier, within that dermal layer, we will have hair follicle, your two types of sweat glands, and oil gland. I have added your nail here, even though nail sits on the dermal layer, but I do want to label it as one of the nail sits on the epidermal layer, but it is identified as one of the accessory glands associated with your integumentary system. So we want to briefly talk about each of those. So nails, again, this is a really brief overview of these structures. What do you need to know in minimal? Nails are actually have a protective role. They do have an area at the base of your nail called the nail root. So basically right here, it's kind of hidden underneath your skin. Nail root or nail matrix is where you have division or mitosis taking place, and that's basically where your nail grows. So kind of similar to what we discussed in terms of the epidermis to the basal layer of epidermis. In this case, the nail matrix is where the mitosis takes place. And the nail root is protected by your folds of the skin, as I mentioned earlier. The specific name for that would be cuticles. Now, for hair, we have a couple of words again that are essential. Again, for hair, you can go into a lot more detail. We're just basically kind of covering the surface of that. Hair follicle, as you can see, is basically the actual structure that produces the hair. So this is called the hair follicle right here. Hair shaft is where the hair actually comes out of the skin. So basically right here would be your hair shaft. And then hair matrix, like your nail matrix, would be basically where you have cell division taking place, allowing your hair to grow. So the hair matrix is located at the base of your hair follicle. Oil glands is another thing that we want to mention. So if I ask you where the location of the oil glands, they are actually at the base of your hair follicle or located connected to your hair follicle. They are producing the oil, and that oil basically gets released to the surface of the skin. Now, the main function of the oil is lubrication. However, it does contain some antimicrobial components as well that provide a level of protection on your skin. Typically, these oil glands are not active until you reach puberty. And at that point, these oil glands become active or more active. Common words you may hear in terms of oil gland is whiteheads and blackheads. We all have dealt with them sometime or other in our lives. Whiteheads is basically sebum, or the oil that is being secreted cannot get to the surface of the skin because the path is blocked. So it basically gathers up underneath the skin, and that forms the whiteheads. So basically what you see as whiteheads are your oil glands that haven't been able to release to the surface of the skin. Now, if these whiteheads starts to oxidize, which is basically a chemical reaction, they can turn into blackheads. And again, you can clear these pores and allow the oil to freely flow to the skin. What we identify as acne, and a lot of teenagers typically deal with them until age of adulthood, is when you have these oil glands basically produce a significant amount of oil, and because of the bacteria that lives on the surface of the skin, find this oil a very delicious, quote unquote, food. They consume that, and allows for the bacteria to basically grow on the surface of the skin, cause infection. And one of the common symptoms of an infection is inflammation. So what you identify as acne is basically inflammation localized to your oil gland as a result of bacterial growth. Next, we have our sweat glands. Sweat glands are actually two types, as I mentioned. First time is eccrine glands. So eccrine glands are the smaller of the two. They are really common throughout your skin, but they are more localized in specific parts of your body. But what you really need to know about the eccrine gland is that it is mostly water, and the purpose of these glands is to cool down your body when your body temperature increases. So these glands, the eccrine glands, are basically essential for thermoregulation or homeostatic regulation of your body temperature. Now, again, these eccrine glands are mostly water, therefore they have limited odor. And typically, if you basically sweat because it's hot, and then let the sweat basically dry off, usually you don't smell any odor with it. Opposite of that, you have these really relatively larger glands compared to the eccrine glands called apocrine glands. And these apocrine glands are essential in terms of, not essential. They do have water, but in addition, they also have a significant amount of protein and fats in them. So when they get released into the surface of the skin, they kind of create that yellowish color. Now, a lot of people, when they see that kind of the yellow staining of the sweat, and they identify an odor with it. So please do note that the odor doesn't actually come from the sweat itself. The odor is because, again, the bacteria that lives on the surface of your skin can use the proteins and use the fats that are in the sweat, break them down, and as a result, produce a byproduct which creates what we identify as the smell of the sweat, or the odorous smell of the sweat. Now, apocrine glands are not active in children, and they usually get activated when you reach puberty, and they are localized to the armpit, groins, and nipple. They are usually activated when the person is either super excited or super stressed. So, you know, when you go to a job interview, for instance, and you kind of like you start to smell your own sweat, that's a different sweat from your eccrine gland that is responsible for cooling you down. Okay, so let's talk about the last part of this lecture, which is focusing on the two types of skin cancers and the type of burns that we can have. So there are three types of skin cancer that we want to talk about, not that there are only three types. They are ranked from the least dangerous to the most dangerous one. So the least dangerous is basal cell carcinoma. This type of cancer is identified as a least malignant, and they are relatively common, especially if you are a person with a fair skin tone. They affect your basal cells, which are basically cells located at your stratum basal or basal layer. The typical shape of these cells is that they're kind of pinkish and they appear as a small domes. They are usually appearing on the areas that are exposed to sun. So a lot of people have them on their face or their hands. Really good news with this is that it can be easily removed and treated. Most people who have basal cell carcinoma, they literally go to a doctor, they make an appointment, the doctor removes them, put a bandage on it, and it's done. I actually have a friend that has basal cell carcinomas removed every about 6 months from his skin because he works outside in the sun. Now, the second type we have is a squamous cell carcinoma. Now, this becomes a little more in a dangerous territory. So they appear as these kind of a small red scaly bumps on the skin. They are localized to usually your head area, which includes your lips, your ears, your scalp. So when they start, they're not too dangerous. However, if they are not treated, they can rapidly grow and they can metastasize, which basically means they can spread to other parts of the body, which is something you never want to hear when you're discussing cancer. Now, Do you still have a chance of survival? And the answer is yes. So you still have a good chance of survival. You can remove the skin cancer and then typically get radiation therapy to deal with either the leftover or remaining part of the cancer. But again, if you kind of ignore that growth and kind of don't handle it properly, it can lead to something much more dangerous. Now, we're at the third category. This is the most dangerous type of skin cancer out there, called melanoma. So as the name melanoma implies, it is associated with the skin cells called melanocytes. So that should sound familiar to us. Now, there are really common characteristics of these skin cancer, which include brownish color. They are irregular in shape. That's a really important one. So you can see the shape of these cells basically being, there's no specific design to them, versus these kind of molds or the other two type of carcinomas we talked about, having that kind of round shape or edges to them. This type of cancer, melanoma, is highly metastatic, which means it can spread very rapidly. It does randomly start, so it has nothing to do with exposure to sun. However, those who do have higher level of exposure and do have a fair skin tone are more susceptible to it, but that doesn't exclude all the other people from this type of cancer. And it is important for you to diagnose this or identify or detect it at early stages to increase your chance of survival. The main problem with this cancer is, or the main problems with this cancer is that first, it doesn't respond very well with chemotherapy. And again, as I mentioned earlier, it can metastasize relatively fast to the rest of the body. So I strongly suggest to my students, if you start to see any sort of growth that has these characteristics, please go ahead and go check it out. You know, worst case scenario, you wasted some money and you identify something as a mold. But if it is flat, if it is asymmetric, there's no specific pattern, the borders are irregular, if that color is that brownish color, and if it is spreading relatively fast on your skin, you really need to go and check that out, please. Now, when we're talking about burns, we're gonna identify 4 main categories of burns. These burns are typically associated with heat, basically some sort of fire, electrical or electricity running through the body, or radiation. So people who might be exposed to significant amount of radiation will see symptoms or will show burns of different degrees. So depending on the severity of the burn, you basically can burn through part of the epidermis, the whole epidermis and dermis, part of dermis, and in some cases, what we identify as 4th or 5th or 6th degree burns, you can actually go all the way to the tissues underneath the skin. Now, typical treatments for the higher degree burns, like 3rd degree burns and above, is what we identify as a skin graft. If the skin graft is coming from a different part of your own body to replace the part that you have lost, that's called autografting. However, if the skin is coming from a different individual, that's called allografting. So let's take a look at the 4 categories of burns that we're concerned about. 1st degree burn, you're basically damaging only the epidermis layer. The typical symptoms is localized redness, what is typically identified as sunburn, I would say. So you do have some swelling in the tissue. You definitely have pain, discomfort. However, a typical burn cream will work on this. You don't really need to take any medication, and it will heal on its own after a few days. as basically you get rid of those damaged cells of the epidermis. Second degree burn, which is where you start to burn completely through the epidermal layer and part of the dermal layer. So in this case, you start to see symptoms of blisters. Again, it will have pain. You will have the typical blisters. You do need to use burn creams to basically help treat the burn, but again, no severe treatment is required. You just let it heal on its own. Both the first and second degree burn are identified as partial thickness burn, FYI. Now, third degree burn is known as a full thickness burn. This is basically the type of burn where you burn through both your epidermis and the dermis layer. Because of the damage to the skin, what the area that's been damaged is usually appear as grayish white, cherry red, or blackened, depending on, again, the damage. There wouldn't be any swelling because basically you have no tissue left. The area will not have any pain. And the main reason is when you look at these severe burns, a lot of times those nerve endings that are located within the dermal layer are completely destroyed. These individuals must be extremely cared for. They must be kept in a very clean environment because basically the layer of protection from the external environment is completely gone. Please do note, it's not on this PowerPoint, but I do want you guys to note for yourself. These individuals are going to be highly susceptible to infections. So the antibiotic is a must for these people. You also need to have them typically almost in all cases have a skin graft to basically cover the area of damage. A lot of people, if you have third degree burn in a good portion of their body, they will not be able to survive as the burn becomes septic, and that may lead to death. Now, please do note that a lot of patients, when they start to recover from a third degree burn, as those nerve endings starts to come in and it starts to heal, they have to suffer through excruciating amount of pain, and sometimes because of that they're put in an induced coma to avoid them suffering through that significant pain. Now, sorry for the gruesome picture, but basically this type of burn, fourth degree burn, and going up fifth and sixth degree burn, these are not limited to your skin. So basically you have already burned through your epidermis and dermis layer, but this goes beyond. You can actually involve tissues that are lying underneath the skin, which include muscles, tendons, and bones, like you can see in this picture. In many cases, that part of the body cannot be saved, and as a result, the person will lose that limb through the process of amputation. Again, this person probably will not feel as much pain because most of the nerve endings are damaged at that site. Here is a depiction of these 4 degree burns, 3 degree. It doesn't include the fourth one. You have the normal skin up here. You have the damage to the epidermis, which is your first degree. You have damage to the epidermis and part of the dermis, which is where you actually start to form blisters. And then third degree burn, where you have burned through the epidermis completely and you have damaged the dermis layer as well. This picture does not depict the fourth degree burn. Now, if a patient comes in with what we identify as burns, how do we actually measure what is their burn and what is the severity of the burn? So they actually use this kind of a checklist. So this is going to give you an idea in terms of what is the percentage of the body that's burned. Please do keep in mind that these numbers might be different when we look at children. So this is for an adult individual. So for head, we have about 9%, that's 4.5 and 4.5 front and back. We have 1% for the neck, 9% for each arm, and then total of 32% for the trunk of your body, which is basically 18% for the front, 18% for the back, and then 18 and 18 for each of your legs. So that adds up to total of 100%. Please do keep in mind that, again, if you have a first-degree burn on 100% of your body, assuming, you'll survive it. That's basically is when you have a sunburn falling asleep, both in front and back. That's basically a survivable burn, even though your 100% of your body is damaged as a result of the burn. But what we identified as a critical burn are the following. If your burn is more than 25% of your body and it's a second-degree burn, or a 10% or more of your third-degree burn. So these are basically identified as critical cases, which basically lower the chance of the person surviving. Now, what are the treatment? Debridement, which is basically removal of the dead skin, is the common way of treating burns. You always want to clean the damaged area and remove the dead tissue before you do anything else. You always treat it with antibiotics, just in case anything has got into the system. You need to temporarily cover the burns. Again, this is a more severe burn, not necessarily a first-degree burn or second-degree burn. And then a skin graft if it's required. So if you're damaged, your skin is completely removed, you must cover that part with a skin graft, either autografting or allografting, to make sure that the body can start to heal itself. Now, last thing I want to talk about, which is I think something that you probably will see in a hospital setting, especially if you have people that are bedridden, is what we identify as a bed sore or a pressure ulcer. This is the type of damage that comes to your tissue as a result of the body being in the same position for a long or extended period of time. So basically that added pressure for that area of the skin will cause the skin to slowly wear off. The most common place you can see this type of ulcers is the hip area, ankles, and heels, where there's basically bone. And the most common type of treatment is, of course, antibiotic. You want to make sure the wound is clean all the time. If you can move the patient to a different angle or different position to remove the pressure on the ulcer and allow the ulcer to heal, that's always a good idea. And lastly, or more specifically, not necessarily lastly, is removal of the damaged tissue, which basically enables the body to start the healing process. So that is it about your integumentary system. Again, please do note that this is not a very detailed lecture. We have covered as much information as I deem necessary for your class. Of course, as you go through your program, you will learn more about each of these systems based on the degree you're acquiring.